From KELOLAND Media Group, an Inside KELOLAND Health Beat special. COVID-19 questions answered.
Thanks for joining us. I'm Tom Hansen. This week on a special Inside KELOLAND Health Beat, we have an update on COVID-19 as new cases, active cases, and hospitalizations are rising across the state. Today, we have an update from South Dakota's Health Secretary and State Epidemiologist. We'll break down the latest numbers and find out what the rise in cases means. Could we be headed back to where we were last fall? Plus, a look at vaccination numbers and find out if we're making some progress. And throughout the show, we will answer your questions. We'll look at a variety of topics, from the rise in cases to vaccines and dealing with the threat of COVID in schools. First off, let's take a look at where we're at and what's happened in South Dakota over this past month. 1 month ago, we were still doing weekly updates. In 1 week, there were 268 new cases reported. The state had 400 active cases, and 33 people with COVID-19 were hospitalized in South Dakota. Just over 2 weeks ago, the state went back to daily updates, and those numbers had gone up significantly, including triple the number of active cases and double hospitalizations. Jump to the latest update on Friday. The state reported 439 new cases. There are nearly 4,000 active cases, and there are 168 people in South Dakota hospitals. Joining me now are South Dakota Secretary of Health, Kim Melsom-Risden, and State Epidemiologist, Dr. Joshua Clayton. Thank you for joining us today. And let's just get right off. Kim, what are you most worried about right now?
Well, we are seeing a rise in cases, as the numbers you just shared show us, and we expect to see more cases. So that obviously is concerning. We didn't want to be in this situation at this point in time. And so, with more cases comes more hospitalizations and potentially more deaths. And so those aren't the trend lines we'd like to be talking about right now. Fortunately, we do have some tools in our toolbox that makes this look different today than it did a year ago.
Josh, how about you?
I think one of the things that I'm most concerned about is just, seeing where we're at with increasing cases and going into the fall when we typically see respiratory pathogens start to circulate. So, this includes a respiratory syncytial virus, or RSV, where we have individuals hospitalized now, and we've seen that impact healthcare operations in other states. And, we want to make sure that people have a focus on doing what they can to prevent themselves from becoming hospitalized with COVID or with other pathogens like influenza that'll start up this fall.
One thing about this show is we ask viewers to send in some questions, so let's get to some viewer questions right now. We've been talking about the rising numbers, and Beth wants to know what level of cases and hospitalizations would we see before declaring a state of emergency, Kim?
Well, there's not a hard and fast rule as it pertains to, what triggers a state of emergency. Certainly we've used that tool in the past so that we can make sure we have resources as needed to take care of folks in our state. We are actively working with the healthcare community, and our healthcare providers have been amazing throughout this pandemic in terms of providing care to people that need it. And so we'll continue to communicate very regularly with our hospital partners and other healthcare providers so that we can, make sure we understand what's happening in their world in addition to the data that we have, so that we can get through this next phase. I'm hoping to do that without another state of emergency. Again, we've got more tools today than we had in the past. And so if there's any bright side, we know people can be vaccinated. That's incredibly important right now. We also have more in the line of therapies that can be provided to individuals to help reduce the severity of their COVID case and hopefully either keep people out of the hospital or shorten those hospitalizations. So we're going to continue to monitor the situation and take it as it comes.
All right. Another viewer would like to know how many of the positive tests are fully vaccinated people. Josh?
So what we do know, and because we do track this number, is that we've had a total of about 1,200 individuals that have developed breakthrough infection. That is an individual who has been fully vaccinated for at least 2 weeks after their last dose. So that 1,200 is actually a very small percentage overall of the people who have been fully vaccinated. It actually makes up less than 1%. It's actually 0.3% overall. And so, we want folks to recognize that even though we are seeing breakthrough infections and that we do anticipate seeing more of those as we enter the fall, the vaccination offers just the absolute best protection, whether we're talking about against infection or against hospitalization and death with COVID-19. We know that the vaccine effectiveness against hospitalization and again against death is still very high, even though we're seeing a little bit of decreased vaccine effectiveness when it comes to preventing those infections.
When you do see the breakthrough cases, what do you want people to know about them?
Well, I think, overall, we know that that 1,200 is just a very small percentage, again, of the, 400,000 people who have gotten the vaccine. And that, it is very limited primarily to individuals who are of older age. So 50% of those 1,200 infections are among individuals who are 60 years of age and older. The vast majority of individuals who end up hospitalized or dying when they are breakthrough infections are those who are older or those who have underlying medical conditions. So, we know that the vaccine is a little bit less protective against COVID-19 in some of those populations, just because individuals are not able to produce as high a level of antibody to protect themselves against COVID-19 and the exposures.
Sure.
And Tom, if I might add, I think it's just, it's easy for people to see a breakthrough case and use that, for their reason to not be vaccinated. But again, the numbers really show that there's a very small number of people that are vaccinated that do end up, contracting COVID. And so, please keep that in mind and still consider becoming vaccinated.
Very good. Now, Lisa wants to know if the state is doing contact tracing. Now, she says she knows a number of people who have tested positive after attending the Sturgis rally, and they have not been contacted by anyone.
Well, thank you for asking that question, Lisa. We do continue to do contact tracing, and so what that looks like is if we have contact information, either a cell phone number or an email address that comes with the test result, then we are using technology to reach out to individuals, and we're really asking people to interact with us. Please fill out the survey that we're providing you so that we can have information and help provide you information about what to do next to keep yourself and to keep others safe. For those individuals where we don't have that information, we are tracking down phone numbers and making phone calls to folks. We're still actively doing that. In terms of the Sturgis rally, we are talking to individuals who may have, have a COVID case and may have attended the Sturgis rally. As of this morning, we've seen 63 individuals in South Dakota who have COVID and who, in the prior couple of weeks had attended the rally.
Are the Sturgis numbers what you guys expected?
Yeah, so I think we know the risks of COVID, and we know how it spreads, and we know that if you're around other people in large groups, that there's going to be more of an opportunity for COVID as a respiratory virus to spread. And so, we obviously we saw the rally happen last year. Again, last year we didn't have the benefit of vaccines, and so we, have that to our advantage, and so we're going to continue to work those cases and. Are committed to transparency around what we see in that regard.
All right, we're going to take a quick break. Coming up, we'll have more from our Secretary of Health and our state epidemiologist to talk about COVID concerns as the school year gets underway. Welcome back to a special Inside KELOLAND Health Beat as we dig into the latest in COVID-19 in South Dakota. We are back with Health Secretary Kim Malcolm-Risden and State Epidemiologist Dr. Joshua Clayton. Well, let's get right into our questions from viewers. We have a question about precautions and schools. Susan asks, last year, masks and other COVID mitigations helped keep schools open and keep children and teachers safe. Why not continue the same mitigations this year?
So, that's a great question, and we have a great experience from last year, and we're really happy that kids, for the most part, were able to be in-person learning because we just know how important that is to their development and to their overall health. And so, with that experience from last year, school districts are considering, just how this school year is going to go. And so, we are working with school districts to provide them with the latest information about COVID. We have teachers that have the opportunity to be vaccinated this year, as well as students age 12 and older. And we've actually seen a nice uptick, especially with our younger population becoming vaccinated. So those are going to be protective factors that we have going into this year and throughout the year. And so we're going to continue to provide schools with information about the different mitigation factors that they can use depending on the situations that they find themselves in with continuing to teach kids in person.
All right. Now, Beth wants to know how many active cases would result in the classification of a school as a COVID hotspot, where the Department of Health would step in and address the health and safety of the students and the teachers.
So I'm going to go ahead and start and ask Dr. Clayton to weigh in as well. Again, there's not a real hard and fast rule. It really depends on what we're seeing in terms of cases in a specific environment. And so that can look different if it's, cases in a particular classroom or in a particular school setting, and just how large those settings are to begin with. But we definitely do monitor cases in school settings, and we work actively with those schools to understand the cases that are happening, so that they can take precautions, and we walk through with them different actions that they can take, given the situation at hand. And so that was a strategy that we had last year. We partner with the Department of Education in terms of providing that, information to schools, and I think it was successful, and we are committed to doing that again this year, really watching those cases and, doing that one-on-one technical assistance so that they have the tools that they can use to keep kids safe.
And I think it's also important to recognize, when we're talking about, mitigation strategies, we know that there are a lot of different ways to help keep our children safe as they're going to school. The wearing of masks is just one of those. The information that we've really seen evolve over the past year as we've had kids in school comes down to, spacing of individuals in the classroom has a big impact as well. Having ventilation is a big key component of this to keeping our kids safe as well. So, it's not solely about one intervention per se. Probably the easiest thing is for individuals to be vaccinated, because that's something you don't have to think about. You don't have to think about carrying your mask with you. But we do want to make sure that we have those options open when it comes to reevaluating what the cases that we might be seeing in the school population. And when it comes to the cases that we're seeing, a lot of the research out there is showing that there's not a specific enhanced risk within our school populations. A lot of it is very similar to the background rate of disease that we see in our communities. So the best impact that we can have is trying to decrease COVID-19, within our communities, and also taking precautions as we send our kids to school.
All right, very good. We will be back with our guests in just a few minutes. We're going to talk vaccines. We're at the state for vaccinations and answer your questions about getting the shot. Welcome back. This past week, the FDA gave full approval for the Pfizer vaccine. Officials hope this will help convince holdouts to get vaccinated. In South Dakota, 62% of the eligible population, which is 12 years and older, have gotten at least one dose of the COVID vaccine. 56% are fully vaccinated, meaning 44% of eligible South Dakotans have avoided getting vaccinated against COVID-19. Now we're back with Kim Melsom-Risden and Dr. Joshua Clayton. Let's talk about what we're seeing for vaccine hesitancy in South Dakota. Kim, let's start with you.
Well, I think we continue to urge people to get their information about vaccines, to make that choice, and use reputable sources of that information. You can go to the DOH website, the CDC website. Those sites are always going to have the latest science and data around vaccine safety and efficacy. Lots of stuff circulating out on social media that just is not true. And so we're really urging people to make the decision with the right information in mind. And so vaccine hesitancy sometimes comes from just having the wrong information. What we do know about vaccines is that they are safe and effective. We see that borne out not only in the clinical data that was used to approve the vaccines that we have available to us. We're also seeing that in terms of the data here in South Dakota. Again, we know that 97% of the cases that we're seeing are among people that are unvaccinated. In addition, we're seeing 93% of the people that are hospitalized since January 1st are among those people that have not been vaccinated. 95% of people who have died from COVID since January, again, are among people that are unvaccinated. So we know vaccines work. We also know that they're safe and effective.
Josh?
And so we do know that, as the Secretary mentioned, that the vaccines are safe and effective. We also know that the vast majority of people, if they have a side effect from the vaccine, it's going to be a local reaction, pain, swelling, redness at that site of injection. We have seen, unfortunately, a number of individuals who have gone on to develop either a blood clot or to develop inflammation of the heart. But again, as seeing those cases, on Facebook and so on, that is a very rare occurrence. We know that individuals, when they're getting vaccinated, it's really only about that first 8 weeks after they've been vaccinated that we truly see the side effects from the vaccine. And again, most of those being local reactions around pain, swelling, and redness at that site of injection. So, vaccines are safe, they're effective, and when we're talking about protection, we know that even though we're seeing a little bit lower vaccine effectiveness with the Delta variant, that we're seeing just really high levels of protection when it comes to hospitalization, protecting people from being hospitalized and from dying from COVID.
I'm just going to throw this one out to both of you, and it's in your personal lives, your social, the people around you, have they come up to you and asked your advice? And I guess I'm looking for a personal story. What have you said to these folks? And maybe they're asking, should I get the vaccine or not?
Yeah, I mean, I recall a conversation in my own family here just a couple of weeks ago about the importance of vaccines and just really, the need to follow through with getting vaccinated to really stave off a potentially bad outcome, and that means being hospitalized or even dying from COVID, and that we just know that the risk of getting vaccinated and a poor outcome there is minuscule compared to the risk of being, to becoming infected with COVID or even being hospitalized and dying from COVID, and just really the risks of either of those situations. And I'm really proud to say that the family members that my husband and I were talking to did choose to become vaccinated. Those one-on-one conversations make a difference, and so I think we need to be respectful of people, that people have real questions and concerns about being vaccinated, but we also have the answers to those concerns, and we need to share them with our family members and friends.
Josh, have you come up with something like that?
Yeah, and I've had several family members reach out, and I think, as the Secretary mentioned, really having a reliable source in order to get information. One specific family member had COVID-19 in the past. They during the peak in November of last year, and they developed COVID-19. They were wondering whether they should get vaccinated, and I was able to kind of talk through the fact that even though you have immunities or antibodies through natural infection, that we know that the most effective way to get those protections is through vaccination, and that if you've already had COVID, you should still get vaccinated as well. It does a great job of enhancing the antibody levels that individuals have, even if they've had COVID-19 in the past. So, there are other examples where, I've had an opportunity of speaking with a hesitant family member around some of the concerns that she saw on Facebook around fertility issues associated with the vaccine, and we know that there's been nothing that's proven in the literature. In fact, what we've seen is It's safe for a woman who wants to become pregnant getting the vaccine. It's safe and effective for the baby as well, for pregnant women to be vaccinated. And so, we know we have a lot more data than we did when we started off. And so talking to somebody, even though there's a lot of stuff that's circulating still on different social media platforms, we want to make sure that you get the latest information. So that might be talking to a family member or friend, or it might be calling our hotline to have speak with one of our staff at 800-997-2880.
Tom, and if I may, I'll also add to that. If folks have questions about the vaccine and whether that's right for them, talk to your doctor, talk to your provider. They know your history, they know your medical conditions, and they're going to give you advice that's tailored to your situation as all. So that's another great resource that we have across the state.
And one of the things that you guys were talking about earlier too is, and I just wanted to hit on this again, was that reactions to the vaccine happen right away, right? I mean,
right.
We would know by now if there were some reactions.
Yeah, you're absolutely right, Tom. And so what Dr. Clayton was indicating before is that in the history of vaccines, and we have a lot of vaccines for serious conditions that have really, made us healthier as a population as a whole. And so over the history of all that vaccine development, poor outcomes have been observed within that first 8-week period after a person gets that vaccine. And so there's no reason to think that there's any difference with the COVID vaccines in terms of, some long-term impact that we just haven't seen yet. COVID vaccines are new. COVID itself is new. But the fact of the matter is that history really shows us that if we're going to see any poor outcomes as a result of the vaccine, that shows up in that first 8 weeks.
All right. Thank you very much. We will continue our conversation on the latest in the coronavirus pandemic coming up after the break. As we wrap up our time today, what do people in South Dakota need to know as, once again, we see cases and hospitalizations on the rise? Kim?
Well, again, I think everybody agrees that we didn't want to be seeing cases increase along with hospitalizations, but we do know what we can do. We can get vaccinated. We can use those mitigation strategies. We can, continue to look at the data and make smart decisions. And, we've weathered this before. We're going to do it again.
Josh?
And I would say that, we are coming up into the fall, and so we want to make sure that we're keeping people safe, not only against COVID-19, so go out and get vaccinated, but making sure that we're also protecting people against, one of our routine enemies of influenza. The hospitalizations, for COVID, for influenza, will both be taking up space and time for our healthcare providers. So make sure that you go out and get vaccinated.
All right, that's all the time we have for today. Thanks for joining us.